Hello, everyone. My name is Deborah Daniel. I'm presenting on Ebola. Dating back in 1976, where it was first found near the Ebola River in East Africa, this virus has major influences on the global healthcare-related indicators. Ebola is a rare but severe and often deadly illness in humans. It is caused by an infection with one of the Ebola virus strains. It can cause diseases in human and non-human primates as well, such as monkeys, chimpanzees, and gorillas. Ebola is only contagious at the onset of symptoms. People who are most vulnerable to the virus are healthcare workers, laboratory personnel, caregivers, and family members who have direct contacts with the infected patient, pregnant women, and children. In general, anyone who has direct contact with the body fluids of an infected person, such as blood, saliva, sweat, semen, clothing, or used needles of the person, is susceptible to the virus and must be reported or reports him or herself straight to a healthcare facility center to be tested. The infectious agents and risk factors. The Ebola virus is an ideal of a long string-shaped bacteria that produces deadly hemorrhagic fever. Close contact with the affected body fluids in any form or excreta or infected objects which are contaminated by this disease makes one susceptible. Therefore, knowledge of these factors is vital to the functioning and development of preventative measures to reduce the transmission and danger to the public. Tests for Ebola virus should be done in specific laboratories by trained professionals. The WHO and CDC guidelines for the collection, transportation, and submission of specimens for Ebola virus testing must be adhered to. Anyone who has had contact with an infected person must be tested immediately for the virus. Types of tests include antibody capture enzyme-linked immunosorbent assay, ELISA, virus isolation by cell culture, electron-microscopic, antigen capture detection test, and reverse transcriptase polymerase chain reaction assay. Infectious window. This phase is the time of the symptoms presentation up to the time when the virus is completely eradicated from the human body via laboratory test. This takes from 2 days from the time of symptom presentation to a couple of weeks, say 21 days or more. Symptoms of the Ebola virus include fever, diarrhea and vomiting, abdominal pain, bruising, fatigue, and bleeding. The infectious window, again, for Ebola virus is 2 days before the appearance of symptoms to the time that the patient is cleared of the virus via laboratory testing. This may take up to 3 weeks or more. How to protect staff and prevent spread. It is important to use personal protective measures correctly throughout the usage and disposal of PPE. Do not touch fluids or objects that are infected or contaminated with the virus. This should be followed by an effective sterilizations of rooms and environment at large. All related equipment must be sterilized with utmost precision. These are the important steps to prevent staff and control the spread of the infection. Isolation is imminent. Other considerations include implementation of structured mental health care for both the staff and the patient. Also, it is good to get the officials well trained. And again, isolation is vital. Contact tracing also helps. I give room for questions. Thank you.